Hello, welcome to MagnaWave Office Hours. I'm Pat Zemer, CEO of MagnaWave. We come to you every Tuesday at noon to answer your questions, whatever they may be, about MagnaWave, PEMF, training, machines, whatever those questions may be. We're here to answer those questions. So we're glad you're with us. We ask that you share this. If you're watching us on Facebook or YouTube, share this with your friends. So if they'd like to join us, they can do that as well and enjoy and maybe perhaps get their questions answered if they have questions. So please share this with your friends. If you'd like to talk with me, send a text to 502-599-9722, and then I will phone you back. So send me the text with your name, and I'll get your number. I will be able to call you back, and then we can talk and answer any questions that you may have. I like to do it that way because we quite often get deeper into the context of the question that you're asking. If you ask a question in the chat box and I answer it, then that's great, but sometimes I can go deeper if we're interacting and talking back and forth. So if you'd like to visit with me, 502-599-9722, and I will then phone you back and we can have a conversation accordingly, which we're excited about and look forward to doing that. Just want to cover a couple of things here quickly. The practitioner portal is back up and running. You will need to change your password. So just go into the portal, click Forgot Password. It'll send you a link. You can reset your password and go forward. If for some reason you're having some trouble after doing that, just send us an email to support@magnawavepemf.com, and Teresa will get right back to you and help you get set up with what you're needing to do to get logged into the portal. So once again, the portal is up and running, so we're pretty excited about that. Also, as you know, we have a new device. It's called the Spiro Go, and it's a lower powered, more like the Simi 3 device that we now have available. It's a total digital machine from MagnaWave called the Spiro Go. And this month, it includes, if someone purchases, it includes the large loop, butterfly loop, and the Mag Energy mat as part of the bundle and the package. So jump in there and have a look at the Spiro Go. If you have any questions, I'd be happy to answer them. Received a question the other day: do any insurance companies cover PEMF therapy? Well, if a doctor, some states to a doctor, a chiropractor, or a medical doctor will pay some insurance funds to the doctors. For many states, though, it's not covered. For practitioners, if you're not a doctor, then typically it is not covered. Now, in the equine space, on occasion, people have their horses insured, and the insurance companies are familiar with MagnaWave. And so if your owner checks with their insurance company and it's a serious enough situation that they feel that this will be beneficial, then some equine insurance companies have on occasion covered the insurance. But as a rule, today, PEMF therapy via practitioners and even some doctors is not covered by insurance. Part of the challenge is that they have to, each insurance company decides what modalities, what therapies they're going to approve. And because PEMF has been outside of the world of medicine for so long, as it was moved away from the practice of medicine by the AMA about 100 years ago or so, it is very difficult to get insurance companies to cover it. Now, that is changing. As more and more devices become approved through the FDA, insurance companies are having a look at it and understanding, and some are coming around to cover it again for doctors in those types of situations. But as a not as a non-doctor practitioner, then it is very difficult to have the services covered. Many chiropractors around the country today operate on a cash basis normally, and so they don't even worry about the insurance. It's all cash basis because it's just what they pay sometimes on the insurance isn't worth taking care of and handling the insurance as part of the situation. Okay, let's see if anybody's texted in. No texts coming in at this point. So if you'd like to talk to me, 502-599-9722. We are on CastBox. Hazel's with us on CastBox, and we're glad you're with us on StreamYard. And we got several people listening and watching, so we're glad about that as we proceed. Again, if you have any questions, just put them in the chat box, and we'd be happy to have a look at them. Let's see here. Let me have a look. Hazel's on from from Michigan. Tracy Walker Bush is with us. Becky's with us. Katie's with us this morning. Mary Lauder is with us. Jamie Bowe, thank you for being with us. Mary's with us. Good morning. Dolores. Catherine is with us. Sue's with us. Hello. And Idle Hour is with us as well from Chicago. So a lot of folks are here, and we appreciate that. If you have any questions, put them in the chat box. Let's see. Can the LZR be used over skin applications of serums and essential oils? The answer is yes. You can use the LZR over topical applications that you're applying, and you can. That's fine. There's no reason that you would not want to do that. Now, if you're using something that is light sensitive or something that whatever, you might want to check with the if it says anything on the labels or anything like that. But typically, the LZR can be used over topical applications. What you quite often do is allow the application to get on, begin to absorb, then put the light on or just above it. You may not want to, if you're using a topical, you may not want to put the light right on it, touching because of the topical. But it will help the infusion, just as the MagnaWave will help the absorption of the topical into the bloodstream or into the body. What you may do in some cases would be perhaps to treat the area with the LZR, apply the topical after you have used the LZR, and then treat with the MagnaWave to help get the pulsing, to help the infusion into the absorption into the tissue and into the body. So there's several different ways you can approach that. Sometimes with the LZR, what they've done, if they're using it over a wound or if you're applying something, you'll put a piece of cellophane, not cellophane, but a piece of clear plastic over the machine, like a what am I trying to think of here? The plastic wrap over the machine or over the wound, and then place it right on the wound, so you're not touching the wound itself with the light, so it doesn't keep it clean and so forth. So those are some applications that you can use. But to use it in conjunction with topicals and the MagnaWave should be okay, and something that you can do. Okay, then let's see, what do we got here going on from California? Piper's with us from California, from Houston. Felicia's with us in Houston. Cameron's with us this morning. Then not citrus essential oils. They cause photosensitivity. And there you go. That's what I was talking about. So if you're using some types of oils, you might want to look at the manufacturer of the oil, who it comes from, and talk about photosensitivity with light being used, and you can get some direction in that manner from the manufacturer of the particular oils or whatever you're using as a topical. Thank you, Dawn, for sharing that with us. If you have another question, simply put it in the chat box. I'd be happy to answer it and discuss it with you. Send me a text, 502-599-9722, and I would be happy to visit with you and discuss whatever it is that you would like to talk about. Okay, certainly MagnaCon's coming up. Our plan at this point is MagnaCon to be live next year, live in-person event, just as it's been, except for this year. Tickets are on sale. There's a $100 discount if you buy before the first of the year. So if you're thinking about coming to MagnaCon and you want to save a little money on your tickets, purchase before the end of the year, and I believe there's a $100 savings there for you to join us for MagnaCon. I know we've done a lot of work, Elaine and the crew, of lining up new speakers, additional speakers, a lot of different in-depth type of stuff going on. So in terms of the animal world, we're going to have, when you talk about live animal and hands-on training, we're going to have horses, certainly small animals, and even some bovine is the plan at this point. Large animals, bovine, to demonstrate treatment methods and how to do and what to do. So I see that they put a link up for purchasing tickets to MagnaCon, so you can have a look at that and join us at MagnaCon this year. We're looking forward to having a great time, and we're certainly hoping that things will be able to go live and be in person for MagnaCon. Again, any questions, drop them in the chat box. I'd be happy to give an answer and have a look. Let me jump over here and see if there's anything else. I had a client that was treating people that have had some pre-existing injuries and different fractures. And the comment was, after they treated, they were a little more painful the day after. what I can say is what you really need to be careful of, and people do it so easily, is they talked about treating for 10 to 20 minutes and people felt some pain the next day. Your best thing to do is, if you're treating someone for the first time, treat them for 6 to 8 minutes. And treat them on a very moderate to low setting so they can begin to understand what's going on and feel it a little bit, and then feel some result. If you overstimulate, if you turn it up a little higher, and I'll tell you what I always do. I'll ask someone, how's that feel? And they'll say, oh, fine, I can take more. If they say, I can take more, tells me that they're on the edge of comfort. But they're thinking they can take a little more. If they're there, you don't want to go there. If you're talking about injuries that are in the hands or the elbow or the knees or the feet, we all know that you can apply a lot more energy to those areas before it's felt, or a lot more energy more comfortably administered at that point in time. That does not mean that that person has to have a huge amount of energy to make those areas feel better and to relieve some pain. And so what I always recommend is to start lower first and let them become used to it, let them experience it, and then go a little higher as they become more understanding and they know what to expect and what's going to happen. It is certainly possible, and I've told this story many times about the gentleman that I treated that had broken his back 4 or 5 times and had a very high threshold for pain. Didn't tell me that when I treated him. It was when I was first getting started, so I treated him on his back, and he said, I'm not really feeling anything, so I moved it higher, and he said, well, I'm still not really feeling anything. I'm feeling some movement in my gut and so forth, and so we treated him a little higher. Next day, he came back very sore and not very pleased. The following day, it's like a deep tissue massage. He felt much better. But you don't want to treat someone at a level thinking, I got to get a lot of energy in there because I've got to have it work for them. And then all of a sudden it was a little much, and the next day they're sorer than they were the day that you administered the treatment initially. So I always maintain, start at a very comfortable setting. And again, is that all right? And they'll say, yeah, I can do more. Don't do more, do less. And it's just a good way of administering and a good way of starting. Once they get going and they understand what's going on and you can apply a little more energy, then you're good. They can receive more energy and they'll understand what it's going to do. So you don't want that to happen. I think I can tell you in my years of working that's only happened a few times. Every time you treat somebody for the first time and you turn it up a little bit there and you treat their knee, they're not going to have a Herxheimer reaction or detoxifying reaction. If you treat someone for 30 minutes and you're treating them on a pretty aggressive setting, then yes, you can cause those things to come to surface a little more rapidly. But I can tell you that in my years of treating initially, maybe once or just a few times have I had someone that felt worse following the treatment than they did prior to the treatment. And so just err on the side of comfort. You can say caution, but err on the side of comfort for your first couple of treatments. Maybe you don't need to go as long, and perhaps your setting is not as high. Let them get used to it. Let them have it. You're better off to have somebody that does it. Well, I really didn't feel much. I felt a little looser, and then do it again. Then somebody say, boy, I was really not feeling, it hurt a little bit because they received too much energy. Then they don't want to do it again. And that's not what we're looking for. We're looking for people to be comfortable and for people to get the results that they're looking for with these treatments. Is always a good way to approach it. If you'd like to discuss that, or if you have questions about that, simply come on board, send me a question, send me a text, 502-599-9722, and I'd be happy to get right back to you. Does the PEMF ticks accelerate the dissolution of Botox or Dysport? We've not experienced that it gets rid of Botox that's been injected into a particular area. You might do well to let the Botox that's been injected, or people, whatever they're doing, let it get settled a little bit. And then quite often there's a bruising situation. And what we're going to be able to do is to help the bruising with the improved blood flow and those types of things. So you always want to understand the context of what's going on. We do that a lot with medications in animals. Let the medication be administered via, whether it's through an injection or orally or topically. Let it get in, let it do its job a little bit, and then come back and enhance what's happening. In the situation with wounds, we all know on animals, on horses, that it will help the speed of the wound healing. And but we want to make sure that bleeding is not in place when you go do that, and so forth. So to approach it from that perspective. So if you have a bruising situation, whatever the cause, whether it's from some form of an injection or something that's going on, this will help get rid of the bruising and allow things to allow the body to be set up to heal more rapidly. All we're doing is improving the blood flow and the oxygenation, so the body feels better and can better do its job. So typically in those types of situations with those types of injections, certainly talk with the doc and wait for things to happen. But we certainly recommend let things stabilize and do what they're supposed to do, and then go in and try to take care of some pain relief or bruising or whatever may be there. Okay, interested in a protocol to MagnaWave an 8-pound dog with bladder stones. The x-ray showed multiple small ones and a couple larger ones in the male 13-year-old Morkie. Any practitioners that are watching or reading this, I'm up for your suggestions as well. Of course, there are practitioners that are watching and may be able to put some information in there. Stones are an interesting thing. Certainly, if the stone, we're not going to break up the stone. So if the doctor feels that the stone can pass and without surgery or without laser intervention to break it up or something like that, then certainly mild treatments, pulsing the area, can potentially help them move. And if the veterinarian's in agreement with what you're doing, help them move away and out of the system. You don't certainly want to cause discomfort. If you got a stone that's too big to move on its own, and by your pulsing, it's putting it in a position to where it's causing pain because it can't be passed or get out, type of thing. So those are questions that you need to talk about with your veterinarian and get their direction on how to do it. But certainly to treat over the area and mildly and get some movement in there to enhance what's going on. If the veterinarian's in place with you, that certainly is not an issue and has been seen to be beneficial at the direction of the doc that you're dealing with. Again, size is the thing that you need to question and make sure that you don't do anything to cause discomfort in the animal. Is it common for a horse to have sweat spots after treatment? I'm treating her on 1 or 2 using the Simi 5. Well, a horse can. I mean, every animal is different, and you're stimulating, putting energy into the body, and you're causing things to happen. You know, there are animals that we try to treat to get them to sweat, horses that won't sweat, following a particular protocol of the esophagus and the lungs and treating the body to try to get them to come around to resume sweating. So it's not abnormal in some cases for an animal to have sweat spots. It's not an issue. That's simply showing you that there's some kind of stress in that area, and you're loosening up, or you're working with it, and it's allowing the animal to sweat in that area. Would it be something that you might want to discuss with the vet? We treat and we get these sweat spots. They may be able to put their knowledge to play and to help discuss that and show what to do in those types of situations. But again, every animal is different. So you treat a horse today and this does this, you treat the similar horse tomorrow and you get something different in how they react and what's going on. So each animal is different. And so you're going to see that the difference in each situation. Amy from Ocala, hello. And Rianne has a question. How long is HydroWave good when mixed with drinking water? I'm thinking of adding it to a large water dispenser, kind of like a deep rock dispenser in an office space, and wondering if it will last a couple of weeks. Once it's in the water, in its form of oxygen and the silver molecule, and you mix it with the water, it's not going to deteriorate from that situation. So to put it in something, conceivably it can last a good while. The shelf life of HydroWave is very long, years, and so to put it in the water is certainly viable. I would probably say you'd want to do it a little more closer to when they're drinking and when they need it. Do it in that fashion. To put it in and just let it sit is fine, but you do have degradation of water that occurs over time with dirt and sediment and so on and so forth. But the theory is to put it in your dog's drinking water in the morning and leave it in there. I mean, you have to leave it in there. It's in the water. You don't have to pour it out and let the dog consume the water over the day. You could do the same thing with a horse to try to get that into the body to do its work, do what it does to help with bacterial killing bacteria, bad bacterial and so forth. So that's a way to take a look at that. All right, let's see. In a Brita water dispenser, that would be fine. Thoughts on using MagnaWave following flu pneumonia injections? Does it help alleviate the side effects? Well, in any situation where there's discomfort and you want to have some relief to the breathing, some people with breathing situations put the MagnaWave on their chest or on the chest of the animal to help good blood flow, good oxygenation in the lungs, which can help the situation and help boost the immune system. And so there's no reason not to think that you couldn't use a device on the back of an animal or on the back and get some good movement in the lungs to have better blood flow, better oxygenation in the lungs going forward to help those types of situations. It can help eliminate the side effects of some different things that you're taking or people are doing. So there you have it. Based on what you were trying saying earlier, is it 6 to 8 minutes for the first time user on a low setting in general, or first time users who have pre-existing conditions? Got a couple of calls coming in. Well, you just want to make sure that the client is comfortable. And that would be a good way of going across the board. Like I've said, when people first start using the machine, my recommendation is put it on a very moderate setting and begin using it. And then over time, you will learn how to turn it up a little bit. You'll see the muscle movement as you move across the animal or the back of a horse, and then you can get accustomed to it. But to go in and go after it very robust first time out is not necessarily the way to do it on a continual, ongoing basis. And particularly if someone's got a pre-existing condition, you don't know anatomically what's going on there, and so you need to walk softly. We always talk about, for example, where you have implants and rods and screws and so forth. And the recommendation is to treat, make sure comfort is there, treat for a couple of minutes on a very moderate setting, make sure they're comfortable, they're not feeling any issues, then begin to treat and progress along in that fashion. And that's just a good way of approaching the situations. Okay, let's have a look here and see the message. Michelle is calling. I'm asking for Stan, who is driving. Can you compare the Simi 5 to the Spiro Go? Okay, they posed that as a question. They're driving, so I don't want to get them confused as they're driving and going along. Can you compare the Simi 5 to the new Spiro Go? Very close. The Simi 5 is probably 10% stronger than the Spiro Go. They're very similar in their Gauss delivery and the strength of the devices. It's difficult to get things to match up perfectly as these companies are perfecting and dealing with their devices. But as you use it, they're very similar in their overall power setting and how they are controlled. And it would be a preference kind of thing. Certainly, the nice thing about the Spiro Go is that it has a 90-minute timer, so you could put it on a mat, put it on your bed, go to sleep with it over your shoulders, and then when it quits, and later in the evening, just move the mat and you're out of the way and you're sleeping comfortably. And so you could do that very effectively with a 90-minute treatment. The Simi 5 does not have that capability of having the long times. It does have a new 20-minute timer, which is very beneficial, that you can do a very similar type of thing, but it does not run for 90 minutes. But again, the two devices are very similar, just different manufacturers producing the similar type of device. So I hope that was helpful, Stan. And if you have further questions, send me another text, or if you'd like to discuss it, send me another text, and I will call you. I just don't want to bother you if you're driving, and I will call if you'd like me to do that if you want to discuss it further. All right, let's see. Aaron's answering questions. Another question. I was treating a 4.5-year-old mare that had EPM at 2.5 years old and stunted her growth. I'm wondering if with loosening her up, MagnaWave in her areas of stress might reactivate her growing and growth spurt again. 4.5, anyone with this kind of experience would really be grateful to hear the input. And I would too. I find it pretty interesting after, 2.5 to 4.5, 2.5 to 4.5 years. That's a big amount of time. And horses are very well fully grown or nearly fully grown in that span of time. So once things are acclimated, I can't say that it maybe wouldn't do it. I'm just saying that it's certainly something to contemplate and look at. But I think that things are in place for a good while at that point, and that phenomena just happened and it occurred, and that's the size that the animal became. But that's not to say that you couldn't experience something different than that as you go forward. And Aaron's answering in more detail some of the questions that are being posed and people are talking about. 502-599-9722. If you'd like to talk with me, send a question. Let's see. She's an Oldenburg. That line still grow till 6 years. And if that's being the case, if it's normal for them to grow to reach their maximum growth in 6 years, and we're at 4.5, and the problem occurred at 2.5, if they're still capable of growing, treat them. I would do everything I can to get good blood flow, good oxygenation, good nutrition, good use of proteins that are in the body, and let the body do what it needs to do to give that energy and that health to the animal. And you may very well experience the growth patterns that you might be looking for. Very interesting. Do it and tell us what's going on. Let's send us a testimonial and let us know how it goes. Okay, here's a question. All right, let me get Leslie on here. One ring-a-ding, two ring-a-ding.
Hello?
Hello, Pat Zemer here.
Hi, have a question about old scar tissue.
Okay.
I had my knee replaced in a couple weeks. It'll be 9 years.
Okay.
And I made a ton of scar tissue. They had to go back in a couple months later and do a manipulation under anesthesia, and then arthroscopically cauterize scar tissue. And I have limited range of motion in that knee. I can bend on a good day 90 degrees or just over 90 degrees. And I do MagnaWave because I have a Simi 3. I get, when the weather changes, I've got a barometer in my knee now, so I get pain and stuff.
Right.
And the MagnaWaving helps with that. Well, can it help get rid of that, scar tissue that's like 9 years old?
It's not going to get rid of the scar tissue that's there. However, it can soften the scar tissue that's there. So you can maybe improve the elasticity of the tissue. That can improve your range of motion. You can keep it just in a sense that maybe the barometer is not as strong as it is if you're doing it continually. I presume when the weather changes, you treat your knee because it's telling you to treat it. But what you can do is to treat it very regularly, and to which will aid. I've had racehorses that I received a call from a trainer in Florida, racehorse, and let me get rid of that. And had scar tissue built up on the ankle of the horse, and it was impeding the movement of the ankle. And so we began treating it two times a day, 10 to 15 minutes each treatment, moderate setting, and quickly they learned that it made the scar tissue more pliable, the range of motion returned, and the animal was able to go forward. But it did not dissolve or get rid of the tissue that was there. So after that length of time, the 9 years, it's a little difficult to do that. If you'd have used it at the beginning, you can keep the scar tissue from developing, from building up, which is why there's a lot of use with this after injuries and after surgeries and so forth. So I would search for having it give you a better range of motion, but if you've got it, it's going to be difficult to get rid of the tissue.
Okay. Yeah, I wish I'd had it at the time.
Right.
The recovery was extremely difficult.
Oh, that's a shame.
Lots of inflammation and swelling.
Right.
So, would you recommend like daily?
Sure. Absolutely.
Okay.
Or a couple times if you wanted to, but when you're finished for the day and it's evening and you're watching TV or reading or whatever you may be doing, put it on your knee and just treat it. And you could put it on a setting and treat it for 30, 40 minutes. The more you treat, it's like a vitamin. If you don't need it, it's just going to pass through. But in this kind of case where it's chronic and you want to try to make it supple, you can do it longer and more often.
Okay. Yeah. Sometimes I do just keep hitting the timer again and again.
Yes.
Okay.
All right.
Well, thank you very much.
You're welcome. Thanks for calling.
Bye-bye.
Bye-bye. Good question with regard to scar tissue, and that's kind of the things that we like to talk about. The sooner if you have an injury, if your animal or your horse has an injury, the sooner you can get after it, the more you can limit the inflammation, kind of keep things in check, and allow that animal to better heal itself. Animal or your client to better heal themselves, and that's what it's pretty much all about. Let's see. I MagnaWave the older dogs I see weekly for 30 minutes. They all love it and have great results. Is 30 minutes too long? No. I'm presuming that you're treating different areas of the animal. If it's a dog and you're treating their hips and you're doing it for 30 minutes, you don't have to go that long. That's what I was just discussing a moment ago. I used to do full horses upper body in 20 to 30 minutes. And that's really all that's necessary. That doesn't mean that you may treat the upper body for 20 or 30 minutes and then treat both feet for 5 or 10 minutes each. And now you're at 40 minutes for the overall session. So, and I've said this millions of times, it's easier to give time than it is to take time away. And so certainly the animals that you're treating, the dogs you're treating will allow you. And again, if you're treating front, back, and feet or hocks or whatever it may be, your legs, you may find yourself in a situation that your treatments run 30 minutes to 40 minutes. But as a rule, 15, 20 minutes should be ample to do what you want to do. And then if you feel that they need more or you want to give them some more, certainly do that and make things better for the animals. Great question. Let's see. Okay, so Aaron's on there, bringing more detail to the crew and making things easier to understand. Let's see if there's any more. If you'd like to talk with me, 502-599-97. 502-599-97. Oh my God, now I've forgotten the number. Absolutely, 502-599-9722. Oh, Chris, here we go. 502-599-9722. If you'd like to visit with me, send me a text and I will give you a call right back. Let's see if we've had any other questions over here to address. Got a lot of people with us today on CastBox. We always appreciate that. I'm doing the full body. Yeah, that's perfect. Is when you're treating the animals. Again, as you know, the Spiro Go is available, and this month comes with the large loop, butterfly loop, and the Mag Energy mat included. If you have any questions on that, simply put them in the chat box or give me a shout, and I'd be happy to answer them. Let's see, what else might there be? Let me have a look over here and see if I got any other questions. I need a good MagnaWave guideline for canine asthma and a good veterinarian recommendation who they may consult. Well, certainly asthma's situation, difficulty breathing, so treating the neck, esophagus, lungs to make sure that there's good flow, good oxygenation in the lungs can be very beneficial for those types of indications. Certainly, you're talking with your veterinarian, tell them what you're doing. Dr. Sandra Snell is very good. We have a lot of veterinarians who follow in the practitioner portal. So when you ask this, there are people that can come to you and approach that. I'd recommend you going to the MagnaWave International PEMF education and research page in Facebook, and you can search for asthma and see what type of results folks have had as they have treated those types of indications. But certainly the thought of the medication enhancing or helping the medication be better absorbed or better utilized by the body, that's things that we want to hopefully accomplish when using MagnaWave and doing it in that fashion. So I would certainly, again, consult the veterinarian, Dr. Marty. If you send an email, well, of course, you've got it here, but if you would send an email to support, Aaron can forward that on to Dr. Marty, and he can have a look at it and give us his conversation or his input on that type of situation. So we've got a bunch of veterinarians in the crew, and they can all approach that and give us some answers. But again, just the situation of going in and working with the lungs and the blood flow certainly should be beneficial to care in those types of situations. Let's see here. Again, we're back. Jill asked the question, had a client that expressed that her neck was sore after her treatment. Sometimes something happens as you treat somebody, you treat an animal, and I used to have this, people would say, my gosh, what'd you do to my horse? Did you drug him or what'd you do? And I say, fresh? And they say, yeah, well, they feel good. And so sometimes you can treat somebody and then they can go and overextend what they're doing and exacerbate it to return. Comfort is always the key. Comfort when you're treating, and let the person know that they need to hydrate themselves adequately. Let them know to relax. Just because they've been treated and they might feel a little better time of treatment doesn't mean they need to go run around the block or climb a ladder and stress themselves and re-exacerbate what's going on in their body. So it's always important to kind of explain what you're doing, what's going to happen, and how it can be felt. And again, always err on the side of comfort, at least for the first few treatments, so someone can get it and feel it and feel better. That's one of the neat things about the Simi 3 and the Simi 5 or the Spiro Go is that they're lower power units. You can treat a little longer, but you don't have to. And so people can get them, they can feel it, and they quite often have a better feeling going in. Maybe not to the point that they can get with the Pulse Pro or the Max or one of the more powerful units, but it's a place to start. And that's how it's best to handle it and go from that position when you're having a look at treating the folks as you go forward. Let's see. Nothing else on there as far as treatments are concerned. So if you have a question, put it up there and I'll answer it. If we don't get a lot more questions, then I just don't want to sit here and babble unless I have something specifically that you would like to know about or discuss. So simply put it in the chat box, send me a text. I'd be happy to call you and discuss and get right to the issue that you want to talk about. 502-599-9722. And that's a good way to get started. I don't see any other questions coming up. So again, if you have a question or a comment, please put it in there and I will have a look at it. Let me look here and see if there's anything else. Ackworth, Georgia who had this? Oh, Tina asked a question. Who's been using LZR? What are you treating with it? How do you like it? What are the results? Great question. The results that people are experiencing with the LZR are very positive. They're using it in concert as a complementary method modality along with the MagnaWave. I just had cataract surgery. It's been about a month now, and everything went great. And I used my MagnaWave immediately after my surgery to speed up the process. And the doctor was very happy with how it turned out. When I went in for my 30-day examination, my right eye has a little inflammation remaining. And so I went back on some drops, and I'm treating it daily, twice a day with the MagnaWave, and then once a day with the LZR Ultra Bright right over the eye. Close my eye and put it right on there. And it's been bothering me for a week or two, but I was out of town. Then I came back and went to the doctor last Friday or Monday it was, I'm sorry. And he gave me said, get back on your drops and do this. And already today, and I can judge this, I can close my eye and look out of my left eye, and it's perfect. I'm seeing 20/20 in my left eye. When I do my right eye, it's getting better. Yesterday, I couldn't make out any words from this type of distance, just a foot or so with my right eye. But now I'm beginning to see the edges of the letters much better. So I was seeing 20/25 combination, which is not bad. I can live with that. That's a pretty good deal. But the doc just feels like he showed me the scan. They did this imagery thing where he could show me at the retina the inflammation where it's perfect. The surface goes along, then there's a little dip at the retina and it goes on. That's the way it's supposed to be. Mine has no dip on the right eye. It's just obviously got some very inflammation deep into the area. So we're approaching it, and I'm using the MagnaWave in concert with the LZR to treat my eyes after the cataract. So that worked out. It's been working out pretty well. I've been very happy with it thus far, utilizing it in that fashion. It's been fun with the doctor because when I went back after my first eye, after the right eye was my first one, and I went back in the next day, and I was seeing 20/30, and he was kind of, wow, that's pretty good. You're doing great. But then I went back a week later, and he said, you don't need to come back to see me for 30 days. I don't want to see you next week. I want you to come back in 30 days. I went back in 30 days. It was still good, but then I did something happened. Can you come? Let's see, that's another call. Let's see, we do have somebody calling in, so we'll do that. What was the special you mentioned this month with attachment map? I missed it. Ty asked the question. Good, Ty. Certainly the Spiro Go this month comes with the large loop, the butterfly loop, and the Mag Energy mat as part of the bundle that's available. So that's through this with the Spiro Go for the remainder of November. Can you believe it's November and election day, actually? This is interesting. But that's where we are with what's available with the Spiro Go this month, and certainly we want you to enjoy that and have it. Let's see if there's any other questions. How long, let's see, using LZR, how long should you use it that once on an area? Okay, the LZR is designed, it operates for a minute. So when you turn it on, it runs for a minute. In most cases, for a person or a small animal, if you separated the hair, you'd put it on the area for a minute. That's ample. And you could wait maybe and then do it another minute and a couple of minutes, but certainly that's the extent of what you need. It's a very positive, very powerful amount of light that's being administered. And so more than a minute is not necessary normally. And one of the ways that we use it, and it's being used, is for anxiety. Perhaps for depression, is we'll put the light on the forehead for 30 seconds, and then it'll run for a minute. So you're doing 30 seconds, and then come back and put it on each ear for 15 seconds. Could you do 30, 30, and 30? Yes. Do you need to do a minute? No. So it's very, very powerful and very quick in that type situation. So, and that's what's kind of difficult for people to wrap their head around. I mean, when I put my MagnaWave on my eye, I put it on for 10 minutes on a very moderate setting. I'm using the Spiro Go. I've got it over here on the table that I've been using for months and testing and so forth. So I'll treat it at the 5 or 6 setting for 10 minutes, and then I'll come back and put the light on for 1 minute. Now, if you're treating a massive animal and you're doing its knee or something like that, or its back or whatever, you can do it a little longer. I mean, if I was doing a professional football player with the LZR in association with the MagnaWave, we might do it 2 or 3 minutes on that particular person or whatever. Got to keep in mind it's heat and it's light. So if the person that you're treating, or if there's any tattooing or dark skin, it's going to be more absorptive of the heat and the light. So you need to keep that in mind, not to cause uncomfort because of the heat that's generated with the LZR. So that's how you always want to approach that in terms of time. But it's designed to run a minute, and a minute is fine. And if you want to come back and wait a minute or two and then do a second minute, that type of thing. If you're using the LZR and you're using it for inch reduction, what you might do is put it on for a minute and then move it for a minute to the next section, move it to the next section, move it to the next section. So you might take 10 minutes or 5 minutes to move across your body where you want to work on the inches by shrinking the fat cells. Then you want to put the MagnaWave on it to help those fat cells be moved in the lymphatic system and to take away inches and to potentially aid with weight loss. So there's another way to do it. But each one of those movements is only a minute. And so that's how you want to understand that and process it. And that's why it only runs for a minute. So let's see, we had a call. Let's have a look at that. Okay, let me bring this up here. Let me pull it up, get them dialed up, voice call. Oh, they're not answering their questions. Chronic inflammation of sinuses. Any suggestions? Love your Tuesday sessions. Thanks. Well, certainly there's been a lot of times that I have used my device for sinuses. I've had some sinus issues over the years, and I simply take the large loop or the butterfly coil and hold it up and put it at a comfortable setting. I mean, you don't want to be uncomfortable in your mouth if you have fillings or anything like that, and you don't want to cause too much stress in the cranial area. But if you just hold it over the sinuses and treat yourself for 4 or 5 minutes at a very comfortable, moderate setting, you can feel some running. You can help break up what's going on there and aid it. And we've done this sometimes when you deal with athletes. You might want to take your sinus tablet or whatever you might use for your sinus, let it get in and get going, and then work, because it's going to try to do the same thing. And now you're going to enhance or better support what you're doing with that type of situation. So certainly MagnaWave can be beneficial for sinuses and for congestion, head congestion in your animals and your clients, however you may want to do that, but certainly can be beneficial for that. Good, that answers that question. Let's see what we have here. How about using it to reduce fat cells? How long? I just went into that, Kathy. 1 minute on each section as you're working where the area where you want to reduce the fat cells, and then come back and treat with the MagnaWave. What it does is it shrinks up those fat cells to be like a raisin, if you will. They're much smaller, and it just gets them, and then you can take and use the MagnaWave and move them out of the area into the lymphatic system, and the results are very beneficial. And there's a lot of comments about that. There's some testimonials to that effect that you might want to have a look at. How much do you charge if you're just using 1 minute or 2? Well, that's a great question, and maybe some people in the practitioner page can put that out there, but sometimes people increase their session fee by $10, $15 to have the light, to use the light in conjunction. You might treat 2 or 3 areas of the animal. Some may do more. It just depends, but it's not unusual, even someone's using a laser, for them to charge $50 or $60 for a session to use a laser because they have to move it around. Well, you can do the same thing if you're treating a hip, for example, on an animal, and you want to move the hair so the light can actually get to the skin as you're doing it, and then move it around the area. It can take longer. It can take 7 or 8, 10 minutes if you wanted to move it around and treat some of those areas in that fashion. So the fees vary. Their fees vary from let's see, designed to use for, okay, so Aaron's adding some more information about what I'm discussing with regard to the time for the application. and it, whatever works for your charge. But you can, again, you can easily charge an additional $10 to $15 with your treatment, if not more. And maybe some folks will share in the on the MagnaWave Certified Practitioner page as to what they are charging. I know that's been asked a lot, and you can go in there and ask that question, and people will respond to you with their fees and how they are applying them. Okay, let's see. Any other questions? No other texts for conversation? Certainly want to answer all those questions as we can, as we get them, and answer your questions here live with you today on the office hours. Let's see. Is C20 safe with other supplements and medications, and any contraindications? I think you're talking, Rianne, about the C60. And the C60 is been, I take it with my daily tablets that I take for I'm borderline diabetes, so I take a diabetes pill, take a couple other things, and I take my C60 every day with it. I've had no issues at all. As you know, when they first developed or found the C60 and developed, they put it through a whole series of tests where they were using it on rats and exposing them to huge amounts, thinking, well, it's going to kill them. And all it did was make them healthier, no matter how much they gave them. And so we know that you don't need to overdo that. But I can't think of any contraindications that I'm aware of with the C60. That's never been any of our conversations that I've had with Max. It would be on the bottle. If you take a look at your label, it will tell you if there's any contraindications or anything not to take it with as you're using it as a supplement. But certainly if you're doing supplementation, you want to talk about, visit your doctor. They want to know what you're taking and what it is. And so quite often they will tell you, well, don't mix these two, or maybe that's their preference, is to not mix two different things or not take two different things. But I have not noticed any particular issues where there are contraindications from the C60. I mean, my goodness, people are using C60 for hair growth. They're using C60 for, drinking massive amounts of it for detached retina and seeing very good results in many of those types of indications just by boosting the telomeres and in the body, which is our barometer, our ideal of our health and how things are going in that area. So great question. Yeah, C60, oops. There you go. So yes, and Aaron also adds some information about that to the page with regard to the C60. So if you have any other questions, simply put them in the chat box and we'll get to them. Aaron, thank you, by the way, for your participation today and answering these questions. And a lot of folks have joined us today on CastBox. We're glad about that. If you have any questions, put them in your chat box and I'd be happy to take a look at those as well. Let me just take a look here. Nope, nothing there. And so it's always fun to be here and to answer these questions and to spend some time with you on Tuesdays. It's fun, it's rewarding, and it's a good way for all of us to learn more and to go forward, providing better health and wellness for our clients. And that's what it's all about as we learn more about MagnaWave and what we need to do. Okay, I'm not seeing any other questions pop up at this point, so I'm glad that you were with us today. If you have not voted, go vote. And I'm not going to tell you how to vote, just go vote and take a look and see what happens as the day moves forward. So I'm Pat Ziemer from MagnaWave. I'm always glad to be here with you. I always enjoy your company, and I hope we answer your questions. So wave on to better health. Have a great day. We'll see you next week. Bye-bye.